Hey hikers, before we get into today's episode, I just want to let you know that I'm currently enrolling for my Hiker's Knee Prevention program. Now, I'm looking specifically for hikers who struggle with some type of knee pain on the trail and who want to get strong and pain-free over the next 12 weeks so they can conquer every adventure. Now, whether you wanted to get started in December or set yourself up for a really strong start to 2021, I would absolutely love to hear from you. So with this in mind, this week's episodes are going to be themed around knee pain while hiking. And we're going to be diving into a few different topics around hiker's knee, which are very important for long-term change. Now, if you do struggle with this and you want to learn a little bit more about this program, please shoot me a message via Instagram, Facebook, or email me at rowan@summitstrength.com.au. From there, we can have a chat and see if or how I might be a good fit for your goals and if or how you might be a good fit for this particular program. Because life is too short to live in pain, and hiking is too much of a wonderful thing not to be enjoying every step of the way. So I really do hope to hear from you. Hey, my name is Rowan Smith and I want to welcome you to the Training for Trekking podcast. Now, this is the world's very first podcast which is entirely dedicated to helping you train, prepare and conquer your upcoming hike, trek or mountain adventure. So once a week, I'm going to be giving you quality and practical information on the subjects of physical preparation for trekking, dealing with altitude and nutrition on the trail, so you can know everything you need to be doing to have the best chance of a safe, enjoyable and successful adventure. So now you know what you're in for. Let's get into today's episode. Okay, hello guys. Today we are talking through some common knee pain mistakes I see from hikers. And these are mistakes I see again and again and again and again from hikers who struggle with knee pain, who are on a bit of a long-term journey trying to overcome this. And these are things I see all the time, from first-time hikers all the way to hardcore mountaineers. And it's something that you really do need to be aware of because they are very, very common. So today we're going to be diving into some mistakes in regards to strength training, in regards to mobility, in regards to conditioning, in regards to gear, and also in regards to mindset. So we're going to talk through a few different situations which I very much commonly see and give you a few solutions to do instead of that. So hopefully at the end of this episode, you can identify if you're doing any of these things, if you do struggle with knee pain, and you can have a clear plan of attack moving forward on what you might do instead. So where I want to start off first is strength training mistakes. Now, the reason I'm starting off this is because strength training is so important in regards to knee pain prevention and knee pain recovery. And in all honesty, in 90% of the situations, it's going to be the single most important thing you need to be putting your focus into. And all around the world, physical therapists, physiotherapists are prescribing this type of stuff, and it is so critical. However, there are some things that I see again and again and again and again, which are just not very, very good in regards to this, from hikers, from programs they're following or whatever it may be. And it's things that are holding hikers back from seeing the benefits of this type of training and actually seeing long-term change in their knees. So to start with is something I've talked about a little bit before, is essentially when someone says, I'm doing strength training, but then they tell me I'm doing lots of squats and lots of lunges. Yes, squats and lunges are good, but that does not count as a strength training program, I'm sorry to say. Now, when we're talking about strength training, we are talking about a structured, progressive, and comprehensive program. That is what's going to help your knee pain. Just doing a couple of exercises and repeating that 3 sets of 10 or 3 sets of 15, it's not really going to get you far. It might get you some benefits, but it's not going to get the results you're looking for. What you need to be doing with your strength training, you need to be doing stuff which focuses on not just the quadriceps, but also looking at the glutes, the hamstrings, the calves, looking at high repetitions and low repetitions, looking at structure over time, progression over time, and a whole bunch of other factors. So when I hear hikers saying, yes, I'm working on strength training, but this is all I'm doing, or I'm just doing these few exercises which is given to me, that is a mistake. And you really do need to reach out to help from someone to get a structured program in place. Mistake number 2 is what I often see, particularly people coming through, a rehab program or whatever from a physio or physical therapist, is just doing, 3 or 4 or 5 band exercises for the glutes or for whatever it may be. Now, band exercises with like TheraBands or mini bands, when you're doing clams or doing mini band walks or doing abductions or whatever it may be, these things are great for a particular outcome. Now, I use a lot of those exercises in my programming to help develop glute medius strength and glute medius capacity. And your glute medius is a small muscle in your bum, which is responsible for helping stabilize the knee. And it's very, very important. But if that's all you're doing, and that's all you've been prescribed for physio to do for months and months at a time, it's not going to get you far. It's a great thing to do initially when you have a flare-up of pain because it's a low load, low risk, and it is a great thing to continue on as part of the whole program. But if that's all you're doing and that's what you've been doing for quite a while, that is a mistake. And again, you need to reach out for help. You need to find some extra assistance there. Now, third mistake sort of goes off that point is doing the same exercises for months and months at a time. Now, the story I always hear from hikers is like, look, I had this issue. I went to see a physio. I got these exercises. I rested and did these exercises. And then I started to feel better. And then a few months down the line, the knee pain came back. And then I did the same thing. I just picked up these exercises, rested and recovered, and then went on this cycle. Or alternatively, someone had an issue, they saw a physio, they got exercises, and they've been doing those same exercises for the last 6 months. Now, the key to long-term change in regards to strength training is progression. And the body gets used to things very, very quickly. And if you've been doing the same exercises with the same load and the same repetitions for multiple months at a time, you are really not getting a huge amount of benefit there, and it's not a good way of going about it. Again, if you're in this situation and that's what you've been prescribed, you need to reach out for help from another source to get a clear direction, a clear program which has progression, which has structure, and will keep you improving over time. Because those band exercises are important at a certain part of your journey, and they are useful in other situations, but they are not a long-term training program. The fourth mistake I often see is never adding load, and hikers being worried to put extra force or extra resistance through the legs and never doing that. So they're always sticking to 15 repetitions, 20 repetitions, always sticking to light weights. Yes, again, this can be beneficial to a point, but as you get confident, as you learn the exercises, as your body gets stronger, you need to start slowly adding a little bit of extra resistance, a little bit of extra load. Now, a huge amount of the research and a huge amount of the clinical studies coming out is higher resistance strength training. So things that are going to challenge the body a little bit more is so beneficial in so many different situations, and particularly for knee pain as well. And it's not to say you need to dive into, heavy strength training straight away, but you do need to be progressively increasing weight, slowly, bit by bit, adding load, adding extra challenge to the body, and eventually getting to a point where you're giving the legs significant challenge. That is the key to long-term change, and you need to be doing that. And then the final mistake on regards to the strength training side of things is forgetting the calves. Now, calf training is admittedly very boring, very dull. But when it comes to knee pain prevention, often the quadriceps get lots of work, the glutes get lots of work, the hamstrings get a little bit of work. But the humble calves, they often get forgotten. But when it comes down to it, the calves do play a role in supporting the knees. They do cross over the knee joint, and they are important to help stabilize the knee and take forces off the knee. So if you're struggling with knee pain and you're doing all your exercises from your physio, but you're not doing anything to help strengthen up the calves and develop extra endurance in the calves, you need to put a bit of focus there, because it is important. Now, that's all the mistakes for now on the strength training side of things. Let's talk about mobility training now. So as we've said in the past, mobility work is very, very, very important for knee pain prevention, specifically mobility in the calves and the ankles, and also up in the hips. Two big areas, super beneficial or super important to look at. But there are a few common mistakes I often see. Now, number one is just doing random stretches when you feel like it. Stretching and mobility is kind of like strength training. You need to have a structure, you need to have a plan, or you're not really going to get a huge amount out of it. If you're just stretching, a couple of times a day or maybe, a few times a week and just doing it when you feel like, yes, it'll feel good and yes, it'll relax you, but it's probably not going to make any long-term change. I highly, highly, highly recommend if you are trying to work on mobility, have a plan in place. Know exactly when you're stretching, exactly how long you're stretching, exactly what stretches you are, and exactly how many times a week you're going to do it. That makes it so much easier to stick to over the long term and makes it so much easier to make change. The next mistake I often see on this is just not holding a stretch for long enough. Now, when you're holding static stretches, so just holding a stretch in one position, a common thing I'll see is someone will hold the stretch, hold it for 10, 15 seconds, move on to the next one. But in all honesty, you're not going to get a huge amount of benefit there. It'll feel good, it'll help relax you, but it's not going to change anything. Ideally, when you're doing your static stretching, ideally you want to be holding each stretch for 60 seconds at a time, or at least 30 seconds at a minimum. If not, it's probably not going to make a huge amount of change. So get a timer out, get a stopwatch. Don't try to count in your head because you'll get it wrong. Do the time, hold the stretch, make it happen. And then the final thing on mobility is just stretching in the wrong areas. Now, if you are self-diagnosing your knee pain and self-diagnosing the stretches, I'm going to say that's probably not a good idea. But if you are, you need to be sure of where you need to be stretching. So there's no point stretching a joint which already has great range of motion and that's not restricted. And I see a lot of people sort of forgetting, missing this. And they'll have 2 or 3 stretches they've done all their life, which they're very, very comfortable with. And they'll do those and it'll feel great. But then they'll have, 2 or 3 areas which might not have a huge amount of mobility, might be really beneficial at working on, but they just avoid it. So you need to be aware of where you're actually putting your stretching into. You need to be aware of where you're going to get benefits from and also what may be restricted. And if you're not 100% sure about that, you need to go see a physio. You need to reach out to me. You need to reach out to another coach and get some clear direction on that so you know where to put your focus on the mobility. So next point or next area I want to talk about is your conditioning. So talking about your cardio, whether it's your walking or your hiking. A few mistakes I often see here is number one, not tracking how much hiking you're doing. So as I said yesterday or the day before, we were diving into, issues of what comes with hiking, why it's such a big issue. And when it comes to knee pain, if you're just doing random distances and you're not 100% sure what you've done week by week, that's going to put you at risk of pain. Ideally, you want to do slow step ups, little bit, and you want to make sure that you're not doing massive jumps in distance. You make sure you're not having massive, gaps in between hikes, and you want to make sure it's relatively consistent. If you're not tracking this and you're just doing random things, that's a big mistake and you need to change that. Number 2 is doing too much and also not enough walking. So in the sense of people who are just doing, some people I see are doing 3 hikes a week or doing 2-hour walks every single day and they've got knee pain. And it's clear as day to me that that's a little bit too much and you need to back off. So if you are looking at yourself and you're like, look, I'm doing huge amounts of walking in the week and I'm struggling with knee pain, then I might be considering reducing that a little bit and just seeing what happens. Now, if you are still, love your exercise and you don't want to stop exercising on those days, choose options which may not put any stress through the knees. So cycling, stuff on the elliptical, in the pool, whatever it may be. But if you are doing loads of walking and loads of hiking and you're struggling with knee pain, try that out and see if it makes a difference. On the other side of things, the people who are just doing not enough walking around their hikes, and they might be hiking once a week, once every 2 weeks, once every 4 weeks, but that's about all the walking training they're really doing. And the issue behind this is the body forgets, in quotation marks, what the forces are around walking if you're having big gaps in between sessions. So it is putting you at a bit of a risk of pain. So essentially what you want to do is fill out these gaps with a little bit of walking. So if you're in the situation where you're only hiking once a week and you're not doing any other walking at all, maybe put a walk midweek. Doesn't have to be long, might be 60 minutes, 90 minutes. See if that makes a difference. If you're doing hikes every 2 weeks, maybe put a couple of short walks in your week and maybe, an hour walk, a 90-minute walk on that weekend you're not hiking, and so forth. And essentially, you just want to make sure you're filling up the gaps of your body, not having a chance to walk and not being exposed to those forces. And you want to give that a crack and see how that goes. The next point is just resting when it flares up. So a common story I hear from hikers is they have an issue, they get into pain, they go to the physio, they do a bit of work, and they're like, look, just rest for 3 or 4 weeks till you get out of pain before you go to hike. So they rest, they take it easy, they get out of pain, they feel good, they go out on a hike, they get into pain again. Go to the physio, they tell them to just rest, do a couple of exercises, give it a few weeks, come back, get into pain, and yada yada. And this is just a never-ending cycle I see again and again and again and again. If all you're doing is resting or all you're doing is tiny little exercises to help get over this pain, it's not going to make any change. Rest is good to get out of pain. Rest is good to help recover, but you also do need to be supporting the body and strengthening the body and getting the body ready for the forces on the trail. If that's all you're doing and if you're stuck in that loop, I'm sorry to say, nothing's probably going to change, and you need to make a difference during your week and during your resting time to help support the body. And then the final mistake on the conditioning side of things is judging your walking capabilities from the treadmill or local walks. Now, a common mistake I see from people going through, a physio process or a physical therapist process is essentially they get into pain, they go through a rehab process, and then the physio tests them on the treadmill or tests them on a local walk, and they're like, okay, you can walk at a certain pace on the treadmill, you should be fine to hike. Or you can do a 10-kilometer hike around the local neighborhood, you should be fine to hike. And then you go out and do a 10-kilometer hike and you get a flare up of pain. So super, super common thing, and it is tricky, but basically you cannot judge your walking capabilities from a treadmill or a local walk. If you're doing 10 kilometers on a local walk, please make sure when you start your normal hiking, start on a 4-kilometer or 5-kilometer, start significantly less and see how it goes. Don't think you can compare the two things to hiking, because there's so many extra demands of hiking, so many extra challenges of hiking, and you really need to be conscious of that. Now, moving on, we're going to talk about a couple of gear things. Two really, really simple ones. And when it comes to gear or just things you're taking is, number one, relying on ibuprofen or relying on painkillers to get through a hike and using that as your sole source of overcoming knee pain. Now, I'm not going to say you shouldn't be taking these things if you're using it as a pain management strategy. Fair enough. But if this is all you're doing to get over your knee pain, and if you're just having a handful of ibuprofen, doing your hike, and then not doing anything to help proactively get on top of it, that is a massive mistake. That is a massive red flag, and you need to get help to get on top of it. I'm not saying don't have it. Don't have your ibuprofen if that's something you need or something that you've been recommended, but you need to be doing things around it, or nothing's ever going to change. And then the second mistake I see on gear is just getting obsessed over gear to help types of gear to help your knee pain, particularly boots. Again and again and again, I see hikers who are like, what's the best boots to help my knee pain? What's the best shoes? Whatever it may be. Yes, they can make some differences, and yes, getting the right pair of boots and footwear is important, but don't spend 99% of your focus there. That should take 10% of your attention, and you need to be focusing on other areas as well. If not, you're never going to see a change. So please be aware of that. Don't put too much focus into those small decisions. Make sure you're being proactive in the other areas as well. And then the final topic I want to touch on is mindset when it comes to this, because mindset and your mental thoughts and your mental approach to knee pain is very, very, very important. And there are two big mistakes I often see from hikers. Number one is just believing it's too late to make a change, that you're just going to have to live with it for the rest of your life. No matter what age you are, that's not true. No matter what situation you're in, that is not true. In the worst case scenario, if you've had some massive knee reconstruction surgery, if you had some major issues, yes, you're probably never going to get back to normal function if that's what your surgeon has told you. But that doesn't mean you can't make a positive change. On the other end of the spectrum, if you're 50, 60, 70 years old and you haven't had any major issues, but you experience knee pain and you're not doing anything to help it, 100% you can make a change. If you follow a smart approach, a structured program, and get the right advice, anyone can make a change. It's never too late. And please, please, please don't accept that as your lot in life if you haven't proactively tried to make a change there. So many times I hear this story and it's just not true. It's something we tell ourselves, but there's always time. And I highly, highly, highly recommend, if you think that in your head, have a sit down, have a good hard look at yourself and really ask yourself, have you actually tried to change this, and have you done everything you can to make a difference here? If not, it's definitely not too late. And then the other mindset mistake I often see is just believing that you're broken. Now, this is a really, really deep issue, and it's a really, really sad to see, But there's so many people I talk to who have basically been told from a physio, a physical therapist, a personal trainer, a surgeon, or whatever it may be, they've told after their issue that they are broken, that they are damaged for life, and that they're never going to get back to doing what they can. Let that sink in. That's such a heavy thing to say. And they may not intentionally realize that, what they've said. But language in these areas does matter. And unfortunately, there are a lot of health professionals out there who don't have the best grasp on language in these situations. The meaning they may be trying to convey may be vastly different to what you have heard. So I'm going to say this. If you struggle with knee pain while hiking, you're not broken. You can make a change. It might be small change. It might be large change. But you're not broken, you're not worthless, and your body is not damaged forever. There may be issues. You may need to make some changes and some moves to help that. But that is so important to be aware. So if you've been told from a health professional that you're broken, that something doesn't work, that you're damaged, I would highly strongly encourage you to get a second opinion and get someone in your corner who can help support you, because the message that health professional was trying to convey may be very different to the one that you've actually heard. And that's purely just due to language and communication. So the very important point to end there. So have a think about that if you think you're in that situation. But basically all these mistakes I see again and again from hikers. And over my 10 years of working with hikers, they've cropped up so many times. If you're doing any of these things, please don't beat yourself up. They are very common, and I'm identifying these today, but they are very common. But if you do think that you're doing any of these things, please, I urge you to use this as an incentive to make a change, to make a difference, because you don't have to live with knee pain forever. If you do need help with this, I would absolutely love to hear from you. As I've said over the last couple of days, this week I am enrolling for my Hiker's Knee Prevention Program. And I'm looking specifically for hikers who struggle with some type of knee pain on the trail and who want to get strong and pain-free over the next 12 weeks so you can conquer any adventure you set your mind to. Now, whether or not starting in December or starting up in January, whatever it may be, if you think you need help with this, I would absolutely love to hear from you. Now, if you want to learn a little bit more about this program, shoot me a message on Facebook or Instagram to the Summit Strength page, or email me at rowan@summitstrength.com.au, and we can have a chat and see if or how I might be a good fit for your goals and your situation, or if or how you might be a good fit for this particular program. If you struggle with this, I would love to hear from you, because there's always room for change, and I would absolutely love to help you get back to hiking pain-free once again. So thank you so much for listening today, guys. I do hope you got a little bit out of this. I hope it's given you a bit of insight, and I hope you have enjoyed it. Thank you so much for listening, and we'll talk to you soon. Bye.